Some big changes are coming to our healthcare system in the next few months that will affect every single one of us. State leaders are currently working out what part Florida will play in implementing the Affordable Care Act. Many of you have questions about this whole healthcare transition, and our Linda Hurtado has some answers.
When I asked my Facebook friends what their questions were about the Affordable Care Act, I was blasted with a number of questions and concerns. So we're going to spend the next week trying to deliver those answers. For those of you who still have questions, we'll have a live chat later in the week. But we begin tonight with a few of the main provisions rolling out and how they affect all of us. Dr. Jay Wolfson, Vice President of Health at the University of South Florida, has been following the rollout of Affordable Care Act provisions. He says decisions made both in Washington and in Tallahassee in the next few months will have a heavy impact on all of us. That's because two of the biggest provisions in the act, the expansion of Medicaid and the creation of health insurance exchanges, require state participation.
Some states have made tremendous progress towards setting those things up. Florida is not one of those.
The reason? Wolfson says the Republican-led state government is at odds with the federal government over how to pay for these provisions and how they will be implemented at the state level. Let's start with the health insurance exchange, basically an online market where people will be able to shop for insurance coverage.
We have a choice of what kind of package we want. They can be low-level coverage with a high deductible. They can be high-level coverage with a low deductible, or something in between, depending on what we can afford and what we think we need. And there are federal assistance programs that are available for people of different incomes to be able to buy those things. But the decision had to be made by the state as to whether or not the state wanted to manage and implement these exchanges, whether it wanted to contract with private entities to do that, or whether it wanted the federal government to do it.
Lawmakers are likely to decide this spring, but Florida has already missed a deadline that officials say virtually assures the federal government will run Florida's exchange when it takes effect in January of 2014. Another one of the biggest provisions in the AHCA, the expansion of Medicaid.
Medicaid is health insurance for the medically indigent.
Starting in 2014, Floridians won't have to be quite as poor to qualify for Medicaid, which would open the insurance program to an estimated 1.2 million previously uninsured Floridians. The federal government will pay for all of the plan the first 3 years and cover 90% after that. Florida's governor opposed the plan, saying the expansion will eventually cost Florida taxpayers billions of dollars if the two sides fail to find a common ground.
The average Floridian who does have coverage may still be affected, even if they're not Medicaid eligible. That's because the people who would be affected by an expansion are going to go to emergency rooms for care. They're going to go to free clinics for care, and the costs of those things are going to be shifted to our private insurance policies.
If Florida refuses the federal funds for expansion,
some other state's going to get it, sure. There's no requirement that a state expand its Medicaid to 133%.
We're keeping our eyes on what's going on in Washington as well as Tallahassee. Also, I found this great website that lays out the timeline for you, what provisions are rolling out, and gives you details. To find that, we've posted a link on our website at abcactionnews.com. Also on my Facebook page, just look for Linda Hurtado, WFTS, under Pages. Taking action for your health. I'm Linda Hurtado, ABC Action News.